Jody, I believe we're good.
Okay, thank you very much. Good afternoon, everybody. My name is Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County, Kansas. Thanks to the media who have joined this virtual news conference and also to the public who are watching via social media. We're here to give an update on the vaccination clinics in Johnson County. And in just a minute, I'll introduce our speakers. Before I do that, just a few housekeeping items for members of the media who are joining us via Zoom and in the Zoom room with us. You will get the opportunity to ask questions. I ask that you put them in the Q&A, and I'm going to take them as they come in order after our speakers make their remarks. What I'll do is say your name, and I'll ask you to ask your question. It might just take a second for us to unmute you. And I'll ask you, once we do unmute you, just to limit it to one question. And then if we get through everybody's one question and there's still some time, we'll come back. So with that, let me let you know who's with us today. We've got County Manager Penny Posto-Ferguson, who will make some opening remarks. And then we have Dr. Sami Ariola, who's the Director of Johnson County Department of Health and Environment. Penny.
Thank you, Jody. I really appreciate this opportunity for both Dr. Ariola and me as a county manager to talk to our community today, because we are pleased to see the enthusiasm and the interest in vaccines. But I first want to start by apologizing for the logistics in how it was implemented today was not what our county expects or deserves. And it will be different tomorrow and going forward. We care for you, those that were directly impacted. I apologize on behalf of the county staff. We care for the comfort and the safety of our especially vulnerable populations, but all that we serve. And we need to make improvements. And for that, I apologize. And I'm going to turn it over to Dr. Ariola to talk about some of the things that we'll put in place. So moving forward, it will be smoother. We are happy that you were able to get the vaccines today, but we need to do a better job in how we administer those. So I appreciate this opportunity so that we could let folks know that we acknowledge it and we're making changes. So with that, Jody, do you want to turn it over to Dr. Ariola?
Yes, we'd like to hear from Dr. Ariola, and then once he is finished, I will start taking questions. Thank you, Penny.
Thank you, Penny, and thank you, Jody. I do want to reiterate what Penny said to our residents in Johnson County, and offer an apology to our residents for the discomfort and the inconvenience that you experienced today. There's no, our goal was, our intent was to get as many of our residents vaccinated as possible today and for the rest of the week. And so the other events and the discomfort and some being in line for longer than is expected, I apologize on behalf of DHE staff, and we have been making adjustments to ensure that doesn't happen again. We'll tell you that we'll adjust to ensure that we have better parking tomorrow. We'll adjust to ensure that we have better traffic control, all of the steps that we need to take to ensure that you are not standing in the elements for while you are there to take the vaccine. We do want the focus to be strictly on you getting the vaccine. You will still be able to be dropped off if we saw a lot of that today. We'll ensure that happens. If you need to wait for any period of time, we're working to ensure that you can park and be in your car closer to the time that you will need to come in. But the way that we've really rearranged the facility, we don't think we will need to do a lot of that. We have had questions about physical distancing. The good thing is the process, once you get in, is moving very quickly. Virtually all of you were respecting distancing and you were wearing masks. And based on what we have in place, we are going to have at least 20 vaccinators there tomorrow We'll have additional staff to assist with flow inside the building, additional staff to assist you outside. And based on these changes, we will make sure that those things do not happen. We want to be sure that we emphasize a few things, and that is it is important that our residents are really willing to take the vaccine. That's an excellent thing. I think that really sets us apart from several other communities. But this is a marathon. We are trying to do this in phases so that we don't get overwhelmed and you don't have to wait too long. So if you don't have an appointment for tomorrow, we're asking that you exercise patience with us. Don't show up without an appointment so that our plans and processes are minimally disrupted. If you need to make an appointment, please go to our website, jocogov.org/coronavirus, or call the health department. We will help you make an appointment. And because we are doing this in phases, right now this week our focus is on our residents who are 80 years old or older. And so if you are younger than that, if you are 65, just give us a couple of more weeks. When those opportunities open up, we will let you know. As we get more vaccine and as we vaccinate more and more people, we would be able to get through all of those that are in that 65 plus category. If you have an appointment tomorrow, we ask that you check your confirmation card for the time that you have. We have really planned this effectively around certain number of persons being vaccinated every 30 minutes. So if you have an appointment at 10, for example, you can show up 10, 15 minutes before the appointed time. But if you have an appointment at 12 and you show up at 9 or 10, it kind of changes our calculation. Please show up closer to the time on your card for the appointment. And again, the process is moving very quickly, and that would be very helpful to our plans. So again, we have additional staff that will be there to assist you tomorrow. For those that have already completed their forms with the details, that's fine. If you do that, it makes it easier and quicker. If you haven't, we have staff that are there to assist you to complete that. So it's also important for you to look at the date for when your appointment is at. I know they all look alike, but sometimes your appointment could be on Thursday or Friday. And so without reading through, it is possible to show up at the right time, but on the wrong date. So please check to make sure that you are showing up not just at the right time, but on the right day. And we're, again, very thankful for your patience. Absolutely, again, sorry, and you have a right to expect good customer service from us. You have the right to expect comfort while we are providing the vaccines to you. And those parts where we didn't quite meet up to that expectation today, on behalf of DHE staff and myself, I profusely apologize. Thank you for your support. Thank you for your patience as we walk through this.
Thank you, Dr. Ariola. So far, we have one question from a reporter in the Q&A. It's Matt Fleener with CAMBC. So if we can unmute Matt, he can ask his question. Go ahead and try, Matt.
All right, great. Can you hear me?
Yes.
All right, very good. Dr. Ariola, thank you very much, and Jody and everybody else, I really appreciate it. We have received quite a few calls and emails from people here at KMBC who are out there at the field house today. I just want to read one of the comments from people that, and maybe just ask you to respond to this, if you don't mind. This person said the people giving shots were actually not wearing masks. No social distancing, 80-year-olds waiting outside in 20-degree temps, no parking, not going by appointment, and not scheduling their second follow-up shot. You know, you've already addressed some of the issues with the, standing outside, parking issues, but can you respond to to people not wearing masks who are giving the shot? I don't know if that's true. And then also, like, the procedure for scheduling that second dose or that second follow-up shot? What is that procedure, and is the county actively doing that to be able to schedule that second follow-up shot? Thank you.
Thank you, Matt. I'll start with the issue of wearing mask. I feel pretty confident telling you that you will not see a single Department of Health and Environment staff not wear mask. We are used to wearing masks. We've been running vaccination clinics for a while, and our staff do wear masks. So again, there's a lot of people in there. The feedback from staff is a lot of the people that are there to take vaccines are wearing masks, and we do require people to do that. And so that is not a feedback that we have received from people. And not only do I have senior staff there, and it's really hard to imagine how that could be, because it's a flow. It's a well-designed flow with supervisors over each of those areas. So it's hard to imagine how someone will be there, a member of our staff not wearing masks. The second part of your question is in scheduling. So once you take the vaccination, we give you a card. And on that card is the date on which your vaccination is due. And then you are verbally instructed to register for a spot to be vaccinated. And so the date is there. The instruction on how to register to be vaccinated is provided before you leave. And again, if anyone has questions, call our department. We have staff on call that will assist you if any of the instructions are not clear to you.
Okay, thank you. We have another question from a reporter, Carolina Cruz. Let's unmute her. I hope I said your name correctly, and go ahead and ask your question.
Hi, I was just wondering if you were planning on expanding your hours just to kind of spread out the flow of traffic.
Thank you for the question. I would say that every option is on the table. We're constantly doing quality improvement on this today and even before today. And every feedback we receive is we really see it as a positive and looking for opportunities to make things better. Now we've looked into expanding hours. I'll tell you, for the hours that we are open today, we gave out 1,778 vaccines, and that's a lot to give even within those hours. But your question is, if we spread it out, would that make it flow better? All options are on the table. We feel pretty confident in terms of our calculations, in terms of the number of staff that we have vaccinators and how many we can get through. Prior to doing that in the 80 plus, when we're doing it for the healthcare workers, we use different formula, and we are pretty close to what we expect with those ones. And here we're close. Again, there are opportunities to improve today in terms of handling people in staying outside. And we feel like we have made the appropriate adjustment, but if we need to make additional adjustment, we'll be very happy to do that.
So I would like to maybe add to that too, Dr. Ariola, a question that we talked internally that may be worth repeating here is that if with especially the population that we're focused on the next few days, if the weather gets to where they don't feel safe, maybe you could touch on the plan for that.
Yes, I think the weather, thank you, Penny, for bringing that up. I think the weather forecast for tomorrow can be a challenge for some, and it's safety first. While we're trying to get you vaccinated as quickly as we can, but we also don't want to put you in any unsafe situation. So if for any reason that you don't feel safe to come by tomorrow, that's fine. You just need to get in touch with us, and we will reschedule you as quickly as we can, and ensure that we walk you into our clinic as soon as we possibly can. What's more important is don't put yourself into any difficult, unsafe situation. We will walk you back in as quickly as we can.
Thank you. We have a question from Shannon O'Brien at Fox 4.
Oh, hi. I just wanted to get some clarification. Dr. Ariola, did you say 1,770, or 1717, the number of vaccines given out today?
1778, just almost 1780 here. 1778.
All right. Thank you so much. That was it.
Thank you.
Thank you, Shannon. And then we've got Carolina Cruz. Go ahead and ask your question as soon as we unmute you. Go ahead.
I was wondering if anybody showed up today without an appointment, if that was an issue too, maybe with the flow of people.
Yes, we did have a few people show up, quite a few without an appointment, and so that's part of why we are. Again, we do need to ensure that we optimize and use the feedback to improve our processes. It will help if people show up only when they have an appointment.
Okay, we will take one more question. Matt, KMBC has another question, and then we will go ahead and close after that. Go ahead, Matt.
Dr. Ariola, thanks again. You know, we've talked quite a bit here over these past 10, 11 months, and I wonder how much of this, you know, obviously you're trying to give a vaccine. You've never done this before. There's a lot of planning that has to go into this. Would it be more helpful to you to know further out from the federal government, you know, a couple of weeks in advance, maybe 3, 4, 5 weeks in advance, you know, how many people are going to be getting vaccines? What more information do you as a county leader need to know to be able to better plan for these types of scenarios and better plan for these types of vaccinations?
Yeah, thank you, Matt. Excellent question. I will first of all correct the statement. Public health, local health department, we've been in the mass vaccination business for a while. We do test those things out. So it's not unique to us. Back when we had H1N1, we gave out thousands of vaccines also in a short period of time across the country. I think now these vaccines are slightly different. They have to be treated differently, but our nurses are pretty skilled in handling vaccines, in reporting vaccines, and all of those things. But to your question is, it is easier to plan ahead if we know what is coming. We up until now, we weren't sure how many doses we'll get every week. I think the week before we got about 3,900. And so there are multiple assumptions that go into our plans. And one of the things that we try to do is look at every possible scenario. So if we were getting 3,000, 4,000 doses a week, that's a different kind of plan. If we're getting a lot more, that's a different kind of plan. But if you really go back into our plan, this is not intended, it is not intended for Department of Health and Environment to be the only venue for vaccinating 600,000 persons. If we do, that would be a very slow process. That's why we have worked very closely with our health systems. And that's one piece of it that people have to remember, that if vaccines go directly to the health systems, to Olathe Health, to Advent, to St. Luke's, to HCA, AKUMED, all of our partners that we have an agreement with, Children Mercy, they have committed to vaccinating in the 65 plus age category. All they are waiting for right now are vaccines to do that. And so that if we do that, it's not just us, it's these 7 other entities that are vaccinating the same category, which gives people option. Actually, it gives people option of working with doctors and facilities that they already have a relationship with. And if you really talk to them, they will tell you, I would love to get the vaccine from where I normally take my flu shot. So that's in the works. We are hopeful that they get vaccine this week and they join us in vaccinating our community. That's a much effective way of doing it. I do want to emphasize that Children Mercy is going to be helping vaccinate our educators K through 12, as well as our child care. That's scheduled to begin next week. So we are approaching this, the plan that we have in place, pretty robust and looking at approaching this in multiple ways, rather than people feeling they have to come to just one or two locations that we set up.
I would also like to add and reiterate the point that Dr. Ariola made earlier, that it's imperative for all this to work smoother, as the adjustments that he talked about that staff's making, but also that don't show up unless you have an appointment. Please respect the process. I know there's a lot of people that want to get a vaccine, and we're pleased to see the enthusiasm for that. But right now we're trying to get our most vulnerable population at 80 plus years old, and so, or 80 years old and above. So in order to have that we're go a little bit smoother, we're doing our part. We're also asking that you don't show up unless you have an appointment. And if you have questions, call our numbers and our hotlines. And Jody, I think you have those you can emphasize for questions. But that is a piece that will help as well.
Yes, thank you. A great source of information is our website, jocogov.org/COVID-19-vaccine. If it's easier to remember, you can just go to jocogov.org and you can find it really easily. We have a daily COVID newsletter that goes out Monday through Friday. You can go to jocogov.org/COVID newsletter to sign up for that. If you're not getting it, that's Monday through Friday. All of our social media accounts, whether it's ours or Department of Health and Environment. Lots of great ways to stay up to date. And we'll be doing more of these as the need comes up to try to answer questions from the media and get information to the public. So Penny or Dr. Ariola, do you have any closing comments?
I would say continue to be patient with us. We're working out the logistics. We have and are continuing to improve. Starting tomorrow, you will note those, and we are taking in your feedback and appreciate you partnership with the community to get these much needed vaccines, that we're all excited that we're in this part of the pandemic, that they are here. We all wish they could come faster. That's out of our control, but we will get them out as quickly as we can.
And
Okay.
Just thank you. That's all. Nothing much.
Okay. Thank you so much for joining us today, and we will talk to you soon. Take care.